Question came in today on the National Parkinson Foundation Ask the Doctor web forum. It comes from Newbie, who writes, "My wife was just diagnosed with Parkinson's 2 weeks ago. She's been taking Sinemet 100 milligrams for 2 weeks but hasn't shown much improvement as yet. She would like to know how long it takes to start showing any improvements. We think she has had PD for a year or longer, but didn't know until the doctor diagnosed it about 2 weeks ago. Also, are there any foods, fruits, or anything that she could eat that might help her? I'm new at this, so any help is welcome." Well, Newbie, it turns out that when you first get diagnosed with Parkinson's disease, your doctor needs to have a really in-depth discussion with you about both medical treatments and behavioral treatments that can help you both short and long term. A diagnosis of Parkinson's disease isn't the end of the world. It turns out we have lots of good therapies that are available and lots of things that can help. The most important thing when starting therapy is to make sure that your dosage and also your response is monitored. The way a lot of experts in Parkinson do this is they have the patients come in off their Parkinson medications, and then they have them take a dose of medication, and the dose you're on is 25/100, and these are called Sinemet tablets or dopamine tablets. This may or may not be the right dose for you, and that's the first question to ask. So the doctor will take your scale called the Unified Parkinson Disease Rating Scale, UPDRS, off your medications from the night before and then on medications, and oftentimes they give an extra dose, maybe 2 tablets, maybe 2.5 tablets, just to see how much change you have. The amount of change that is seen will help them to determine the diagnosis of Parkinson's disease, and then they can monitor and change the dosages to make sure that you are on the optimal dose for your level of disease. Now, you ask, can any fruits, any foods, or any sort of dietary issues impact your Parkinson's disease? It turns out that early on, most people can eat a normal, healthy diet. In some folks, and particularly as the Parkinson's disease progresses, protein or high protein foods may get in the way of absorbing the Parkinson medications. What we recommend in those cases is first, try taking the pills 1 hour before you eat. So give the pills a 1 hour head start so that they can get absorbed into your digestive system before the food has a chance to interact. If that doesn't work, then you can also take the pills separate from the food and restrict protein in your diet. There's a lot of issues that can help you both behaviorally and medically to improve your Parkinson's disease symptoms. So we would urge you to discuss this with your doctor. Also, we know from recent studies that it can take several weeks to several months to see the full benefit of a Sinemet tablet and a Sinemet titration. Most doctors will start low on the Sinemet, maybe a half a tablet a day for a week or a half a tablet 3 times a day for a week, and watch out for nausea, which is a very common side effect early on and can be treated with a medication called Lodosyn, Lodosyn, or a medication that's available outside the United States called domperidone, and that's not the champagne. Now, when you work up the medications, we say work them up low and slow, but make sure that you and your doctor find the dose that works best for you. And we usually recommend that you give the first titration 6 to 8 weeks, and then you wait several months and measure on that Unified Parkinson's Disease Rating Scale that we talked about to see if there are notable improvements. I hope that helps answer your question, and please feel free to write us questions on the Ask the Doctor forum at www.parkinson.org. Also, you can call our 1-800 helpline that's available on our Parkinson website. If you call that up, you'll see that we have lots of specially trained Parkinson nurses who are available to answer your questions. Thank you again for the question, and we look forward to interacting with you in the future.